someone that loves to chew ice and warn them. Chewing ice breaks teeth.
Yup, that's right. Chewing on hard things like ice can break your teeth over time. I know some of you can't give it up, so switch to shaved ice. It's softer. Or you can suck on the ice, but don't bite into it.
First, the doctor will measure the distance between the nose and the top lip. After that, he will make surgical markings to make sure that everything is even. Then, local anesthesia is injected, and this procedure lasts for 1 hour. Recovery time is from 7 to 10 days. She will be able to fully close her mouth, and this is not the representation of final results.
So these masses of tissues growing on the outside of this uterus, this is endometriosis. Essentially what it is a tissue very similar to what normally grows on the inside of the uterus, except it's on the outside. Therefore, when this tissue would typically shed from inside the uterus and leave the body during the period, it's actually got nowhere to go. It kind of just bleeds into the pelvis and causes inflammation and a lot of pain. And this is what endo sufferers are talking about when they say they have painful periods.
Have you suddenly started to notice marks like this appear on your body? Well, these are called stretch marks and they're completely normal, especially if you're going through puberty. Stretch marks can occur when a person experiences a significant amount of growth or weight gain.
Do you know who Cat Lady or Lion Lady is? This is Jocelyn Wildenstein. She claims not to be addicted to plastic surgery and that she didn't do many procedures anyway. This was her in 1970, and apparently her husband was obsessed with cats and she was constantly trying to achieve feline-like appearance. As time goes by, this was in 2000s, her face is getting more volume and it seems like her skin is pulled to the back. What do you think about this transformation?
Finally, exfoliating your skin is getting the praise it deserves. So if you want glass or clear skin, keep watching. You need to exfoliate because dead skin cells can leave your skin looking dull, rough, or dry. It can also result in excess oil and clogged pores, leading to acne. Proper exfoliation removes the layer of dead skin cells clogging the skin and uncovers fresh new cells below. This helps prepare your skin so that your skincare products actually work. So where does exfoliation fit in your routine? You'll want to cleanse and then exfoliate and then the rest of your routine. We recommend exfoliating day or night 2 to 3 times a week. Just remember to wear your SPF every day because you need to protect that baby soft skin that you just exfoliated.
Filler, filter, or implants. Actually, this is very real, and this woman got her cheeks injected with either silicone or derma fillers. Migration is almost inevitable when using anything in this amount. Formation of lumps, bumps, and even vascular occlusion may occur from recklessly injecting so much or just from the pure compression by the filler volume.
Oh, it squirted all over. It's all over her. Oh my God. I cannot believe it just squirted on her. Oh my God. Whoa!
In my cabinets.
Whoa! Oh,
Wait, hold on. Oh, but look how flat it is now. That is the best one we've ever got.
This is what a face-up scar looks like as it's healing. This is 5 days after surgery. Here we are about 7 days after surgery. Here it is about 9 days after surgery. Still looks red. About 2 weeks after surgery. And this is 6 weeks after surgery.
Botox, or botulinum toxin, is a neurotoxic protein which is well known for using it in facial cosmetic procedures, but it is also great at reducing armpit sweat. It decreases underarm moisture from 80 to 90%, and it will last for a couple of months. Botox is FDA approved for treating hyperhidrosis, so it does work. And what do you think? Would you get this treatment done? Write in the comments below.
Here are the top 3 skincare mistakes that people with dry skin make. Number 1, you aren't exfoliating when you need to. A common misconception is that you don't need to exfoliate when your skin is dry. But exfoliating dry skin won't make skin drier. It will actually help remove flakiness, prepping skin perfectly for the application of moisturizer and serums. So once that flakiness and dryness has been exfoliated away, the hydrating ingredients in a moisturizer will work to their best ability to nourish and protect your skin. But be aware that exfoliating dry skin is typically done best with a chemical exfoliant rather than a physical one. Number 2, stop taking those long hot showers if you have dry skin. While they can be nice and relaxing, steaming hot water can actually strip your skin of its natural oils, causing it to become even drier. This doesn't mean you have to shower with cold water, but try warm water instead. Our tip to you, after showering, be sure to follow up with your skincare routine immediately on damp skin. This will help to replenish any of the moisture that your skin may have lost in the shower. And number 3, not wearing SPF daily. Applying sunscreen is important for all skin types, but it's especially important for those with dry skin. Unfortunately, dry skin is more prone to the formation of wrinkles and fine lines, and sun exposure will only accelerate this through a process called photoaging. So never skip the SPF and always reapply.
These are not chin implants, but chin implant sizers, and they can go from extra large to the smallest one. They have different profiles depending on how much augmentation you'd like to have. Also, these are extended anatomical implants, so they can fill out the jowls and you can have continuous jawline. They can be placed from inside of the mouth, there is no scar then, or through an incision from the bottom of your chin. You always ask for before and after, and this patient also had neck lipo and neck tight.
If your back looks like this or that, wash it with this and sprinkle a little bit of this. And if your elbows look like this or your knees like this, first apply this, next apply that.
Sweet girl, little bushy up fitness, be skin smooth here, long ass tits, friends lost to the more yeah, quick fish.
This patient felt like her breasts were sagging, lost their shape, and look a little flat. Also, her skin was stretched. During the breast lift procedure, the breast tissue is reshaped and nipples are repositioned higher, as you can see in the markings. This patient also had breast augmentation with high-profile implants, and without the combination of both procedures, the results would not look like this. The surgeon will pinch the excess skin on the eyelid in a way where the eyelid could still fully cover the eyeball. If too much skin is removed, you will be unable to blink properly or close the eyelids, and the eyes will always be dry. 2 weeks after the surgery, scars will be a bit red. After the healing process, they should be hidden in the crease of the eye. Intravitreal injection is a shot of medicine into the eye, into the vitreous, the jelly-like fluid our eye is filled with, and it's injected near the retina, so it's used to treat a variety of retinal conditions.
This is melasma, one of the most frustrating skin conditions to treat because it's chronic and recurrent, meaning it comes back regardless of how many lasers and other expensive fancy things that you do to it. So I like to rely on skincare, and this includes vitamin C, hydroquinone, cispera, kojic acid, licorice root, and alternative skin lightening agents. Most important is sunscreen. Since this is a condition that's caused by UV rays and visible light, it's important to use a physical sunscreen like zinc oxide or titanium dioxide. These will be a little bit more protective than a chemical sunscreen alone, as well as protective clothing like a hat.
Katie Piper is a survivor of a chemical attack with sulfuric acid, which damaged her skin, muscles, nerves, blood vessels, and in the recovery, she had to wear a mask. Do you know why? Write in the comments below. She had over 400 procedures to reconstruct her face. Elastin and collagen were taken from a cow, actually, and skin grafts from her lower back, buttocks, groin, arms. Also, she had hair transplant to her eyebrows.
You've never been to heaven, have you? Ooh, it's the ride of your life. Hold on, 'cause
Acne is actually folliculitis when yeast and bacteria get inside the pores. Wash with a benzoyl peroxide cleanser, exfoliate with a 1 spray, apply a powder to soak up moisture on your chest and back.
We usually relate lifted eyes, high cheekbones, oval jawline, plump lips, and smaller nose with more feminine facial appearance. That is why facial feminization surgery focuses on these areas, creating delicate differences, but they will become very significant in the final facial harmonization.
Stop doing it like a beauty influencer.
Not all influencers do their concealer the same way, but I'm assuming she means like the big triangle, and I don't like that either. I still want to try her trick. I'm gonna do my regular concealer on this side. I use the Too Faced Born this way, and I tap it in with a sponge. I love how seamlessly this covers, and personally doesn't really look cakey to me. This side I'm gonna use the Kosas concealer, and I'm picking up a little bit with a fluffy brush. And I'm just going to start swirling this onto the areas where I have the darkest, and I'm just going to keep blending this out. And that's it. Look at the side by side. They look pretty much the same to me. The most interesting part about her video is she said don't set it. So I'm gonna set this side with powder like I usually do, and I'm just going to leave this side alone and see what happens. You guys, my concealer already started creasing, and also I feel like the coverage kind of went down compared to this side. I do think she had a really good tip for people that struggle with cakey concealer, but I think I perfected my routine already and it works for me.